Hi, this is our grant proposal. It's by Haili, Jada, and Hannah. Our group is developing a program to support fair wages for childcare workers in Pennsylvania. By comparing local and national pay data, we aim to highlight disparities, raise awarenesses, and advocate for equitable compensation. We will assess how fair pay impacts service quality and worker well-being, identify those needs met, and explore funding and partnership to support long-term solutions for a thriving childcare sector.
Our mission is to advocate for fair and equitable compensation for child care workers across Pennsylvania by raising awareness of wage disparities, supporting workforce development, and advancing policies that uplift the value of early childhood education. Through strategic partnership, data-driven initiatives, and community engagement, we aim to build a more sustainable, respected, and thriving child care sector.
This program addresses the critical issues of low wages and under-recognition of child care workers in Pennsylvania by comparing state data to national benchmarks, identifying risk populations, and promoting impactful change. With a focus on advocacy, wage equity, and professional development, our initiative seeks to support over 5,000 child care workers and improve outcomes for families and communities. We will implement target strategies through public funding, public advocacy, and community engagement, ultimately contributing to a stronger early childhood education system and a healthier economy for all.
Childcare workers are severely underpaid, especially in Pennsylvania, where many earn as little as $11 an hour. Despite their vital role in early childhood development, they face low wages, high stress, and job instability, leading to staff shortages and poor care quality. This affects both the workers' well-being and the development of young children, who need stable, nurturing relationships. Low pay also discourages new people from joining the field, creating a cycle of shortages. To improve outcomes for children, families, and community, we must better support the fairly paid childcare workers.
Some causes are that COVID-19 impact and ongoing labor market challenges, child care costs are too high for families, yet wages are too low for workers, lack of affordable child care, and high cost of living in urban areas, child care often undervalued as babysitting rather than education, worker shortages due to low pay and strict child-to-staff ratios, limited daycare capacity in facilities across the state, fewer child care workers now that the pre-pandemic economic ripple effects limits workforce participation, especially for women, contributes to cycle poverty and economic insecurity, and policy change is essential to ensure fair pay and sustainable child care.
To help fix the low pay and lack of recognition for child care workers, two key solutions are suggested: increasing public funding for early childhood education and supporting professional development. More funding can lead to better wages, which improves job satisfaction and care quality. At the same time, offering training and career growth helps workers build skills and stay in the field longer. Together, these changes can create a stronger and more stable child care system. The plan is to start small, focusing on local areas first to raise awareness and build support before expanding to bigger cities.
Childcare workers in Pennsylvania earn significantly less than those in the cities like New York and Washington, D.C., where wages range from $16 to $18 per hour. In rural areas like Pennsylvania, pay is even lower, making it hard for workers to make a living. This program targets about 5,000 childcare workers in the state, aiming to raise awareness and push for policy changes. If successful, 10 to 20% of these workers could see better wages and job satisfaction, helping move toward the long-term goal of improving pay for all childcare workers in Pennsylvania.
For our logic model, the inputs we have are financial resources, organizational resources, structural resources, policy resources, and advocacy resources. The activities we put were parent tuition support, a social media campaign, collective bargaining, business model adjustment. For the outputs, we put 2 public funding secures, and awareness of the program, and an increase of child care workers. For the outcomes, the initial outcome would be 8% of funding for the program is completed. The program awareness went up 20%. Intermediate outcome would be 30% of child care workers increased, and organizational resources increased by 25%. And the long-term outcome would be campaign awareness obtained 30% of the world, and children attending daycare increased by 45%.
For our budget, we're asking for $183,520 to cover everything we need. This includes paying 3 main staff members, a program manager, a communication specialist, and an ad creator, plus their benefits. We also set aside money for ads like mail, newspapers, and social media to spread the word. Lastly, we include $2,000 for travel so the team can go to events and meet with local communities.
In summary, our proposal aims to address wage disparities among childcare workers in Pennsylvania through a targeted program promoting fair compensation and policy reform. Compared to cities like New York and Washington, PA workers earn significantly less, especially in rural areas, leading to high turnover, job dissatisfaction, and lower quality care. This program will serve approximately 5,000 childcare workers by raising awareness, identifying causes such as low public investment and high living costs, and advocating for solutions. These include increased public funding and professional development opportunities to improve worker retention and childcare quality. The goal is to build a sustainable, equitable child care system that supports both the workers and families across Pennsylvania.
And below are the references that we used to create our grant proposal. Thank you all for listening and tuning in.